Physiotherapy for infants and young children with osteogenesis imperfecta is all about promoting positive development and avoiding negative consequences associated with the diagnosis. The goal is to promote motor development, avoid fractures, and reduce the development of deformities. It's not easy to predict how successful the reduction of deformities will turn out, but the intention is to make them less pronounced. This is especially important for the hip positioning, the back, and the shape of the head. Have the baby lie on its stomach at times to provide varied positioning and avoid the development of a flattening of the head. Support the baby when turning it over. Spread your hands out wide, carry out calm movements, and avoid twisting and pulling motions. This will stimulate hind muscles and provide a good starting point for developing motor skills. The baby's arm should not be placed under its body. The baby also needs some strength in its limbs to be able to hold itself up. For children with severe OI, lying on the tummy is challenging and needs special attention. Place the baby on a soft pillow or small comforter which embraces it, making it easier to lie with more stability. You can build a border around the baby by using a towel or blanket. This gives the baby the ability to use its arms and legs more freely and safely. Stimulate the baby by placing a toy over its head, which encourages reach. Try placing the baby slightly on its side without putting too much pressure on the arm facing the floor. This provides it with another position and ability to move, which is advantageous for the hips and the head. When lifting the baby, make sure to spread your hands out widely in order to maximize the surface of support. You may want to carry the baby by using a mat or pillow if you feel like your hands don't provide enough support. Always carry the baby close to your body for both support and comfort. In a first aid kit, you should keep important phone numbers and information on how to spot and treat fractures. The kit should contain equipment to stabilize a fracture, as well as pain relievers prescribed by the pediatrician. It is also important to avoid the legs from falling into a frog position. Support the legs. By supporting the thighs, you prevent against excessive outward rotation of the thigh bone, which prevents muscle contractures. This again promotes her future motor skill development. Changing the baby is a great arena for stimuli, and it gives a chance for the baby to move without clothing. If you use a changing table with hard edges, make sure there's enough space on the changing table for the baby to move safely. Flailing arms and legs can bump into hard edges and cause fractures. It may be a good idea to place a soft changing mat on the changing table. A softer mat will also support and stabilize the back. Placing the baby on your chest while leaning back will provide a safe space for it to exercise its rear hind muscles. If you're breastfeeding using a crescent pillow, the baby is supported well and the baby's arms and legs won't be squeezed by the mother's body. During the first months of an infant's life, it can be placed in a parent's lap, which provides support and lets the baby establish eye contact. Infants and young children should be handled in such a way to secure the best motor development possible. A few important things to keep in mind are: spread your hands out wide and support the baby with your own body. Carry out slow and gentle movements. Avoid twisting, pulling, and picking up the child around the ribs. Facilitate for motor development by varying surfaces and positioning the baby on its back, side, and stomach. Clothing that is soft and stretchy with large openings makes it easier to dress the baby. Avoid pulling at arms and legs, but instead stimulate the baby and take advantage of its movements. Stroking the baby's arm, it will often respond by stretching it out.
Og så får jeg alt over her først, for å så trekke det over rundt albuen på en måte, men jeg vet at han er med på bevegelsen.